Where's my meeting?
Thank you, Melanie. It is 12:03, so we're gonna go ahead and get started. Welcome, everybody. Thank you for being here. I'm so sorry, lunch was a little bit late. All right, first of all, we will do, approval of minutes. And those were sent out via email last week. And those are also in your packets. The packets.
I make a motion to approve.
Okay, so Melanie Morrow makes a motion to approve the minutes. And Miss Cindy Smith will second the motion. So minutes are approved as written. All right, thank you. All right, so today we are gonna do a listening session. So it's a little bit more of thinking about our community, and we kind of touched base on the, on some topics last time that we had our meeting. For those of you who are new to the meeting, we are doing, Franklin County is currently doing a county health assessment. So at the end of the health assessment, we will have a 3-year plan. So, and these are things that, what do we want to improve in our community for the next 3 years? So today, so we're considering several types of data. You guys heard me talk about primary and secondary data. So considering several types of data, including the first-hand opinions of the community members through the use of listening sessions. So this would be something that we could do, Jesse, like at the community center, outside of our meeting. And we want to take into account the broad interest and experiences and viewpoints of our community. So today we want to get your understanding of the issues that we face, that our community faces, what barriers exist when it comes to health and healthcare, and what resources are either present or missing. Okay, so start thinking of those things. We will also ask you to complete a survey at the end, and this is a survey that we're trying to push out into the community, okay? There was one survey specifically for the listening sessions, but a lot of the questions are very similar to the survey that we're trying to push out. So we're just gonna go ahead and take a moment after our listening session and just complete our survey, okay? Our health department staff completed the surveys this morning, and I mean, they got it done within 3-4 minutes. It really doesn't take long. So we're gonna do the survey afterwards. I encourage group discussion because that's eventually how we get more ideas and, you know, kind of, hey, Miss Kathy, and kind of get to know where do we want to go with this process, okay? So let's go over a couple rules or ground rules. Be kind to each other. There are no right or wrong answers when we're talking about the questions that we're going to talk about here in a minute. You do not have to speak in a particular order. When you do have something to say, please do so. It is helpful for me to obtain the views of each of you. You do not have to agree with the views of other people in this group. I do encourage one person at a time so that we can get a clear conversation and understand everything that is said. Does anyone have any questions? Are there any other ground rules that we're missing? Okay. All right, so we will begin. All right, so just a quick update for those who were not here last time. Last time I asked our group, what are some strengths in our community? And as you can see on your, they're in your minutes, but I just want to refresh your mind. So last time, some of the strengths that we discussed was access to parks and greenways, graduation rate, access to medical care, higher education, Active Prevention Coalition, and Health Council, okay? And then areas of improvement, we have suicide rate in our county, youth substance abuse, overdose rate, third grade reading level, and youth obesity, okay? So just keep those things in mind. So what do you think are our community's strongest assets? Okay, so what do you think are our community's strongest assets? Online, you guys can also feel free to chime in.
Library.
Our library, all right, Ms. Kathy. Okay, what else? What are some strong assets in Franklin County? Okay.
What?
The lake.
Franklin County has a very involved Winchester Police Department when it comes to mental health.
Okay.
I wanted to say something. You know, I work in a lot of different counties and there's something about Franklin County, the partnerships and the collaboration in the community. These meetings here have the biggest turnout of any community meetings I go to in all the counties I work in, and have more people at the table. And I mean, I just love Franklin County for that. Yeah. And most people know I'm a Coffee County resident, but it is something very special about Franklin County, the collaborations, the partnerships, people working together and getting things done.
So strong collaborations.
Yes.
Thank you. Okay, let's get one more.
How about the churches?
The churches.
Yeah, I see a lot of efforts of the churches and stuff in these communities.
Okay. Based on your experience, what are the top 3 issues that you are most concerned about in your community? Basically, what keeps you up at night?
Fentanyl in the school.
What was that?
Fentanyl in the school.
Not even in the school, just
There you go.
Just
Period.
general.
drug use.
Okay.
A big one for me is lack of veteran resources.
Okay.
There's virtually nothing in the county for combat veterans that come home from
The
overseas.
veteran resources, okay.
Along with the drugs goes the alcohol portion as well. Transportation issues.
Hmm.
Definitely.
Huge.
Child neglect.
Okay. Anything else that you guys want to add? Okay. So what do you think are the barriers to address these issues?
Mhm.
What are some of the barriers?
I feel like when it comes to the veteran stuff, there's nobody there's no face for them to come talk to. Like, we have the DAV, but they're not really there that often. And there's nobody for them to feel like they can come to, like,
Like
especially-
availability?
yeah, like, especially with like the younger generation, like, because I'm a younger generation veteran. And when I came home, I didn't know who I could talk to. I didn't have those resources.
Mhm.
So, of course, a lot of them turn to drugs and alcohol because they feel like they don't have anybody they can talk to.
Right.
So I alone have had two best friends commit suicide since we come home because they didn't feel like they had anybody to talk to.
Mhm.
So to me, that's a huge one because we say we support our troops, but when they come home, everybody thinks the war is
No.
over and it's really just a game.
Yeah,
So that's where I feel it's huge.
okay, good point. What else are barriers to addressing these issues?
Lack of knowledge of how to address it and find the resources.
Resources and knowledge. Okay. Lack of resources.
If you're speaking in the room, will you speak up, please, so they can hear you online? So we're talking lack of resources for veterans
For veterans. Lack of knowledge as well.
and lack of knowledge to handle some of the situations.
I think stigma. People don't want to admit that there's a problem because problems are bad, so we don't talk about it, so we don't find solutions.
Alrighty. If you had a magical wand, what top health initiatives, and like I said, not just health, but we have a whole lot, I don't have my core resources with me. a lot of time. But what top initiatives would you implement in your community in the next 3 years?
Give an example.
For example, drugs in the schools. What program could we implement in the schools? I don't know if maybe we can get with an SRO officer at the local school and come up with a program. Or,
There is a program called LEAD.
okay, if there's already something in place, how can we,
Well, I mean, it's available. It's not currently being taught, but it is something available. that we can do.
okay. Do you think they stopped just because of COVID or?
They stopped because it was difficult to get into the classrooms because the school's got so much going on. So stopping class to get in to teach it has been a barrier for them.
Okay. Yeah, this last 2 years has been, it's been crazy.
So did they teach that program here?
They did. They do not currently. But we have an opportunity to bring that back around and lead as law enforcement against drugs. And it's a program that SRO officers can go, it can be taught, and we have an opportunity to pay for that training and then pay for the materials for them to go into the classrooms and teach it. But again, the school is very overwhelmed trying to maintain academics right now, so it's hard for them to get in to do that program.
Okay. But that would be an example, revamping. If there's something already in place, how can we revamp it and, make it more efficient? But if you had a magical, I'm gonna give you guys another example before I ask the question again. So our department, we do a lot with nutrition and physical activity and tobacco. So we've done the Healthy Horizons events, we've done the Life Maze events. That would be something to address those issues. And the good thing about those is that it's somewhat flexible and we can add more things to it, change some of the stations. But if you had a magic wand, what top health initiative would you implement in your community in the next 3 years? We're open to other suggestions from other counties as well.
I would say an increase in like mental health access that's affordable.
Did y'all hear that? Affordable mental health access. I know we have some mental health people online.
What else? What else would you want to implement in your community in the next 3 years to address the issues that we have.
Or domestic violence. More
More
things
programs.
for domestic violence survivors, teens, men, women, and the children that are involved in those situations.
And I feel like that it's in every age. Okay. What else? Let's do one more. What top initiatives would you want to implement in your community in the next 3 years?
I don't know if because of health issues, but I think homelessness is becoming a problem in Franklin County a lot more. I think that needs to be looked at a lot harder, because it's becoming more and more common.
I'd like to see a mentorship program. Like brothers, big sisters, or something like that.
Mentorship, okay. All right. Was there anything else that you wanted to discuss today that we didn't cover? I know we talked about several things.
Maybe even like apprenticeship programs for the high school. I know Coffee County High School is implementing, or they have been implementing a apprenticeship where they're finding kids who, don't plan to do four-year college, or maybe even like, vocational school at this point. So they do that like dual enrollment thing, that they help them get on places, at their age, factories, like some of the factories, and they go there, after school, because that, not everybody is college bound or even.
Right. And we do have our new technical college
Mhm.
that's been open, what, a couple months? So that would be something good. And you were saying specifically for high school?
Yeah, like coming out, because it just kind of gives them the chance to see that they can do more.
Angie says that the Franklin County High School has something like that. You just have to be in the program to attend it.
Okay. Angie, do you know what it's called? We could check it out.
I don't know what it's called, but which I should, because I have a son that's 17 years old that's in the program. But it's a workforce class is what it is. And that's what they do, is like apprenticeships and stuff. So they work with a whole lot of different things. But and also for kids that have like lower functioning skills, they have that vocational rehab, but they're also starting to break away from doing just that and doing more like apprenticeships and like car salesmen, fast food restaurants, mechanics, so they're starting to increase that too. Does that make sense? Am I making sense?
Yeah, yeah. And
Is
I
that
can
what we
also.
were talking? Is that what we were talking about?
Yes.
Okay.
Okay. So kind of shifting a little bit, are there minority groups or other populations in your county that should be considered?
Yeah.
What are some-
Hispanic community.
Absolutely.
There's a language barrier. We don't really have the resources for that a lot of times.
Okay. What else? What other minority groups or populations that should be considered? For veterans?
Oh, for sure.
Veterans?
Yeah, 100%.
All right, so, where do you and others in your community get most of your resources and information? Whether they're health related, whether it's addiction related? Where do you guys get most of your resources? Facebook?
Any kind of resources for the community I've ever heard of come from Campora. That's all I've ever heard.
Cambora, okay.
Health Connect was big for us when we were dealing with the mental health crisis for our son.
Okay.
But I would also like to add that, I know somebody mentioned mental health, but for our children that are under the age of juvenile, how do I word that? That are, this is gonna sound really bad, but that cannot be put into juvenile detention, so they're too young to go into juvenile detention, but they have a mental health crisis that needs to be addressed. There is literally nothing in this county for them for help. You have to be referred to Nashville or
Big
Murfreesboro.
cities.
Or exactly, and
Okay.
for working families, business owners, anybody, low income, high income, it doesn't matter. It's very hard for us to make that work.
Okay.
Health Connect was amazing to work with us to get us the help that we needed. But there's a gap there that needs to be addressed for sure. Because those youth, it's scary to think what's gonna happen to that youth that can't have that access to the help.
Mm-hmm.
Where did you hear about Health Connect?
Where did we hear about Health Connect? I fostered 2 boys and they had Health Connect, and we went to Centerstone and I didn't jive with Centerstone, so I reached out to the Health Connect here in Franklin County and got services for my son there.
Did you like Google it, someone tell you the name? That's what we're kind of looking for, is where it's gonna go.
DCS, when I had the 2 boys in foster care, and then that
I
was
gotcha.
years ago, and I just kind of remembered.
I know a while back we talked about doing a resource. You guys have a copy. Did we ever get to put it like online somewhere or on your website?
We have a whole page of, we actually have more resources on the website than we do on the page of the handout.
Oh, good.
It's right, the fcpctn.org, and there's a resource page, and then every resource that we come across is on there.
Would it be time to update it?
Can you say that one more time? The website is fcpctn.org, and it's also on the back of our newsletter. And then there's a resource tab, and you go there, and every resource that we come across, we put it on there. Right? Yes.
We have that on our website.
Maybe.
The link to
Okay,
the resource page,
awesome, thank you.
the library.
All right, is there anything else that we need to include?
Let me back you up for a second. Is it time to update that? So do we need to like pull that up on maybe in their next meeting?
It may be
And-
good to.
And then we can kind of see where we're at, if someone else has a resource that we don't know about.
That's
Yeah, because
great.
We have new agencies that keep joining, which is great, but it'll be good if we can get their agency information.
That would be good because it's about time for us to reprint anyway. So if we had new.
Y'all want to do it
information.
at the next meeting? Yeah. Okay, so at our next meeting, we will,
Bring all of the resource guides you have, because I know every company has their own.
Mhm.
And let's make sure everyone's, that we have it all. And then, we'll just make a big resource. guide.
yeah. And also, if your agency's already on the resource, double check your information because people, people will move to another county or new
Numbers
employees will come
change.
along, addresses change, phone numbers, so, let's check on that. Because that would be also something really good to do with this process. Okay. Is there anything else you guys want to include before I move on to our next? I'm sticking it right here. Okay. So, let's go ahead and do the survey. And then I've got a couple of things, that I need to mention to you guys. Online people, if you'll go ahead and, Melanie is going to put the link on there. We'll give you guys a couple minutes to finish that. If you'll click on it and take the survey. And then in person, do you have?
I have surveys
We will,
or QR codes, either one.
yes, we have both, whichever one is best.
Who wants digital?
You want digital. QR code. And then I have the hard copy.
What do we put in the blank that says record ID or
We have-
report ID?
Record ID blank. Leave that blank.
Okay,
That's fine. Don't put your name on these. These are anonymous.
Put that with your other stack. I love delegating. She goes, I noticed. She's been overwhelmed today. I need to chill.
Okay, if you're already done it, don't worry about it.
No.
He does.
You live here for a year.
I don't live in this county.
Oh. That's good. No, but I haven't had anything all day.
Hey, we don't have enough.
Set up at the college.
At the college? I'm gonna have to, see if the chamber, my Zumba program is gonna overlap with the business center. When we finish at 7.
It starts at 4:30. The expo
Uh-huh.
starts at 4:30.
4:30. Well, then that,
Or it always has.
because our Zumba program ends on that Thursday. And we will be doing our finals. So we can do that.
We'll be there.
Are you gonna be?
Mhm.
Yeah, we're doing our Independence Sunday. But,
When is your- Like, just survey?
Oh, you're good.
It's okay.
I need to
have
print.
interns can help.
This is what, for like 3,
Maybe.
3 hours?
Mhm.
Yeah, that day, and I'm gonna have to reschedule a class with the date.
Why don't we ask for a volunteer? Include our coalition members. If we're not, if we don't ask, we ain't gonna get it. It's like setting up things.
We'll do the survey.
I have a question.
Can y'all hear now?
When it comes to this survey, we talked about needing, or what our goal is 20% of the population. And we've had maybe 50, well, probably more because we have those, paper ones. But we are in dire need of getting more surveys. And we can't do more than what we are doing. So we are looking for ways to get that survey out there. So if in your workplace, if you can pass out the key grabs and QR codes and have them, we have paper copies of the survey, if you could take them. We are looking for people to help us get out there. So we have the business expo coming up April 2nd.
7.
Yes. And that's in the evening at Monterey Station. Looking at Mel, because she handles all the.
4:30.
At 4:30, and Sophia can't be there, but she can get a tape. Can you get a table? Oh, yeah, yeah, okay.
I mean, if
So
you got a
she-
booth.
Your
Booth.
booth already?
She said she wouldn't charge us, so she said
Okay.
it's just a matter of
Okay.
coming in and setting up.
All right, so she has a booth, but she needs help manning it. The coalition is already going to be there doing our Hidden in Plain Sight demonstration, and that takes quite a few people to do, because we'll have people talking to parents, and we'll have, parents going through the booth. So we could use some volunteers if anyone is available and wants to help, just simply talking to people about the community health assessment and getting the survey done. Is anyone available?
I would definitely be interested in it. I also own my own business, but work within a tattoo shop here in Franklin County. So we have multiple people in and out. I can definitely take some QR codes and paper and get it.
Great.
get it
If you
out there.
take paper copies, they can be returned at the Franklin County Library. Whoop, whoop.
And y'all been awesome helping us with
Yeah,
that.
I said that on the radio this morning. You guys are such a great partner. And you don't get the surveys there.
We love our library.
We did the same.
I love that we're that free.
Yes, so if you are going, and then not just the business expo, if you are going to the ball game and you are doing, I don't know, cash register or ticket booth, please help us take some surveys or the little cards. These,
And I have more cards over there. I can go
okay,
get if we
she's
need
got
them.
more cards that you guys could take today. But this is really easy. They can just scan it on their phone and they don't have to return no paper to you guys.
And a really good way you can help with, not just this, but any campaign that we are doing is to like us on Facebook. Franklin County Prevention Coalition, like us on Facebook, because everything we do in here goes up on there. It's always on our website. But when you see us on social media, hit share. Okay, because you just don't know where that's gonna go and who you can reach. So it's a really, really simple way for you to be very active in the coalition.
Then speaking of spreading the word about the survey, I have contacted the hospital. I've contacted Nissan. Still waiting to hear back from them. Walmart has given us permission to set up. Oh, good. Yes. Thankfully, he was really good and did make us go through his corporate office. We're really thankful for that. I did have to show him the survey.
Right, do you have a date?
No, I was gonna talk to you, because we have to get with the Bonners and Canals.
Yes.
Okay, we'll get with them and choose. I told him, he asked me what days, but I told him that, since we have University of the South helping us with that project, that I would, as soon as they would return from spring break, that we would give him some final like dates. He's on board with it,
Great.
so that was
You
awesome.
back from Kroger?
Kroger's making us go through the corporate office.
Yeah,
So
it's
it's
a
a
good
long
city too, and I haven't heard back.
process, yeah. I've emailed the guy that the manager from Nashville, but. Hopefully, we'll hear about those.
What if you
places
set
soon.
up at like UGO or Save a Lot too?
I know
They're
somebody
probably
that
not
works
that much
there.
corporate that you might have to go through.
We may have to go
Dollar
that
General
route.
too.
Doc-
Um,
that might be-
Kent did say that the weekends would be good. He would rather do weekends because of the busy time.
Good.
So,
So Haley says that the survey has been sent out to all county department heads.
yes.
And I talked to Sharon at the mayor's office, and she said she had sent it out to all government employees.
Good.
So, we passed it out at Journey Food Giveaway
Yes.
this week also.
I've also contacted Mr. Bean, and he said to contact each principal individually and seeing if they can send it out to their own staff. So, that's where all that is going. Our deadline for the surveys is May 7th. It is a Saturday. But that Monday, if you have surveys for me to pick up, if you'll email me location and, I guess, person of contact, and I can pick them up that following week. May 7th is a Saturday, so. We'll close out the survey that day and then gather all of the information and hopefully get them in before next week, or maybe. Okay? All right, so if you have your paper copy, I will maybe pass it to the end of the table and I will select those. Something else I wanted to mention that is not county health assessment, our back to school bash. We have been doing that for several years. And back to school bash, we always collect school supplies and hand them out to, pretty much anybody that comes. It's mainly Franklin County residents. We give them free, whatever we collect, we give them basically free school supplies. The last 2 years, we have done drive-through. I had a small, short meeting with Haley this morning, and we would like to do drive-through again this year. And then we'll see in the future about opening up to back to in-person. As of right now.
I have a suggestion for this.
Uh-huh.
It worked much more efficiently when it was dropping. Would it not make more sense to just
Keep
keep
it,
it that way?
it's fine.
I mean, it's so much faster and no nonsense than waiting on people to line up and taking your time at each. It was just,
Yeah.
more efficient.
And it's, the day of is less setup to do.
You
When
just
it's
don't get to
drive-through.
pass out resources.
Right, we just put them in the backpacks. I'll tell you what, though, in Grundy last year, we had, our event at the high school. And people, we had vendors that came in, they didn't set up a table, they just had a chair, and literally, they were handing out their own resources. So we could try that this morning, we kind of went out there and kind of worked the logistics of it. And we could fit some vendors, if any, agencies wanted to come and set up. But what we want to do is, if we're gonna be drive-through, keep it flowing, you know?
What if, because one of the draws is, you use to advertise because you're there and you have your signage and that kind of thing. Put signage out along the line of people driving, who's donated. So if let's say Russell Burnett donated, then we can put a Russell Burnett sign there.
Like a yard sign.
You're
Wow,
saying
the
like
yard
add
sign would be
advertising
helpful.
to it.
Yeah, your time might be a little cost prohibitive, but we can print it till by 18.
We can print like a poster.
Pulling up at the sign, a QR code. I mean, because it's not fast. enough
Right, it's
where
not
you couldn't
fast.
stop and take
Yeah.
pictures of each one and maybe pull up their QR code on their sign to keep it direct access.
I think we could figure something like that out.
You have a big laminator.
Yeah, we do.
Another good thing is that Haley, mentioned that we could do it at the health department. That way we don't have to move things left and right. And, you know, we've kind of got some experience with COVID and draft.
Right.
So, I thought it was a good, I mean,
I love it.
because it's right, I mean, I don't have to move things everywhere. So, that's one of the things. Another thing is that the last couple of years, we've had different entities in the county do a back to school bash. And I know there was some confusion last year where a lady donated to what she thought it was our back to school bash, and it wasn't. So, I wanted to mention this to you guys, and y'all feel free to vote on it. But the other health educators in our region are doing, they call their event Give a Kid a Chance. Would you guys be okay if we just changed it to that instead of back to school bash? The reason being because there's so many that local places do, local churches, other entities, which is fine. There's nothing wrong with them using the same name. But I feel like there has been confusion in the past with people donating. So when she called me and she said, hey, did you receive? I was like, no. I never received it." And the guy never, he used it for his back to school bash. So I was like, okay. So would you guys be opposed or would you guys be okay if we just changed it to Give a Kid a Chance? And usually they, I know it's a long name, but usually they just abbreviated GAKAC and the other counties. So what do you guys think? I don't know, do we have to make a vote on that?
Probably.
It's a motion, somebody,
And a motion that we vote.
okay, Jesse makes a motion to, okay, second, I guess it's.
Let's vote.
I just wonder, does it have to be that name or?
No, it doesn't have to, it's just something that we've used in the past, and I like the, I guess, giving a kid a chance to, for education.
And it's something that's been specific to, because that's your point, is that others are using back to school bash. and
Yes,
it's
which
causing
is-
Confusion.
Yes. And it can be something else, if y'all have a better name for it, that's fine with me, I just wanted to make our own, like, separate from the other. And make our own. What you think? Give it a chance, or something else? Or think about it, and next month we can come up with a final. Our library folks, any?
This is until August, right?
July. As of right now, we have it set for July 20th. It's a Wednesday.
Oh, that's the day we have story time, the chance you guys are going to do it in the lower parking lot.
What time is your store? What do you think?
We also have camps and stuff. But our lower parking lot is pretty big.
Pretty big. Yeah, because we,
Located.
last time we did it here at the gym. And I think they were lined up to recycling place. Not the recycling, not next to us,
Right.
where they have all the metal.
Is there only one access entrance and access point? So they'd be able to go through one and out the other.
What's the date you said?
Huh?
The date.
20th?
Yes, July 20th. July 20th.
Yeah, the only thing that we could think of maybe would be, it would just be the exit. Because you enter the library two ways. You enter the lower parking lot two ways, and then there's two exits. But it's that one street, so if they're waiting in line, that's not gonna cause the backup.
Yeah, that would be
And
the,
leaving shouldn't either.
and usually the Winchester Police Department will assist us. I mean, they've been awesome. Every time I ask them, can you please come and help us direct traffic? They've been really good about it, so. Yeah, I guess we can talk about it and see. I can drive by.
Okay, so
We
next
also
month
want-
we'll vote on the name.
Yes, and if y'all wanna, I mean, it doesn't have to be Give the Kids a Chance. If y'all wanna change it to something else, that's fine. Bring
Good start.
ideas next month.
Good start.
Yeah. Good start. Bring your ideas next month, because I really want to definitely just change the name, because of the donation issues. And then we'll plan on doing, I guess, letters again, Jesse. We'll revise the letter that we had last year, and if we need to change anything, then we will do that. Okay.
About the location, the high school was a really good location because there was no problems entering or exiting because it's so big, large. We're not affecting traffic,
And we've done it there before as well.
and there was lots of space. Lots of space.
I'm fine as long as it works out with everybody else. All right, so next time, bring names, possible names for our back to school bash, and then your preference of locations, since we talked about 3 different locations. I may just bring some index cards and let everybody put their, okay. All right, so we have about 10 minutes. At this time, I would like to open it up for updates.
I have one more thing I have to add. We are doing the Chamber Coffee April 11th. And we would love to have some coalition members there to kind of, just to kind of support us and to be there to answer questions anyone has about, what it's like to be a coalition member, that kind of thing. So if you're available at 9 o'clock on April 11th, please come see me. I would love to have some members there.
But if it gets moved on. All right, so let's do any announcements or upcoming events for in-person folks. Timing?
As always, there's a post going on at the library.
Library always has good stuff going on.
FCLBRY.com.
Any updates on your
Hashtag it.
story? Pardon? Story trail, any updates on that?
Yes, there is, as a matter of fact. We are now in the production stage.
Okay.
So the panels are being made. We're using the Stanton Molly Lou Millen. It's going to be down by the Red Roof Pavilion. So we're just waiting on these panels to get here and hoping for a late spring or early summer grand opening.
Good,
More of
good.
that to come.
Let
Or
me
if you're on a
know.
guest list, if anybody has anybody they'd like to be there, just
Okay.
email us.
Let me know when it's the grand opening and all that, because Sue Fulmer had great ideas and, she's willing to give us some, giveaways. Some really
From
nice
Kiwanis
giveaways.
Or from Mount Pleasant.
I want to say probably both. Yes, but we had really good, we're talking about, physical activity and youth and stuff, and, we thought it would be a great idea to give the giveaways at your storybook.
Trail Tail.
Trail tip. So, keep you posted.
Okay.
Something. April is Sexual Assault Awareness Month, and as an agency with Haven and Cove, we're doing proclamations. We would like for the head of Health Council and Prevention Coalition to sign a proclamation if y'all will. And we're gonna get several other city officials and things to do this.
Yeah, the mayor's really nice about signing.
We haven't had a chance to talk to him yet, but he's on our list.
Good.
And, I don't know if we've talked about it. We have a new position in our county. We have a sexual assault advocate, but that's, solely her specialty, and that's what we should hear. So we're proud to have that.
Welcome. Any other updates?
I don't know if this fits with everything we're talking about, but me and Alan have been working on together, and my wife's been working with him too, but starting April 6th, I'm gonna start having meetings here at Camp Aurora for veterans, where we can do group therapy. That way if veterans need somebody to talk to, they can come to my group on Wednesday nights between 6 and 7. And it'll be completely veteran ran, be ran by me, and my wife. We're gonna do it for veterans and veteran families. That way, if they're struggling with anything, they can come down there, they can talk to us, and it's a vet thing. There's no doctors involved.
Awesome.
Nobody that's gonna tell them, hey, you need to go do this or go do that. All I'm there for is, if you need another person to talk to that's been through the things you've been through, and I'm here, and we're gonna make sure that the families are taken care of and try to get them linked out to resources that they can get help with. So we know a lot of resources, we got a lot of people that are gonna back us in this,
Good.
so we're really trying to get that out, so.
What
Anybody-
time is that?
From 6 to 7 on Wednesday night. If anybody knows any veterans that can get involved in that, or would like to be involved in something like that, I'd love it. I really want to help our veterans in the area.
Definitely. If you guys have a flyer, or if you create a flyer, if you'll share it with Jessie, and she can share it with me, or I'll see if I have any of my cards with me, but we can definitely get it out.
Awesome.
So going along with that, I also spoke with Haven of Hope and Alan about doing something more domestic violence outreach, kind of working with them. Teen violence, the families of domestic violence survivors, I really want to put together, or am going to be putting together, healing days once a month-ish, maybe starting. I've got a photographer, a massage therapist, a cosmetologist, a hairstylist that are willing to donate their time for these families. Completely free, obviously. I'm gonna just get out there and do more with our domestic violence survivors and the families, because it's really needed. I'm gonna do meetings here as well. I just have not nailed that down. I think during the day, when their kids are in school, might be better for them. But I really wanna open it up to where there's more support, and the times are not limited, if that makes sense.
Right.
So it's still very beginning stages, but it's gonna be put out there, so.
Okay.
There'll be a
Awesome.
Facebook page, I'll make flyers and all of that.
There's a lady that's doing something, not, this is similar, but not really, from Salvation Army. They're, partnering with Mountain Massage. And they are doing a parent and child matters night on the 26th, I think it's this Saturday. At the Swanee Community Center.
Yep.
And the kids will be doing yoga and like, fun stuff, and the parents will also be doing like painting rocks, yes. So, if she is willing, I don't know if she covers Franklin County, but maybe that's somebody that you guys could also partner with. I love that they have stuff for families like that. Awesome. Yeah, whenever you guys have your flyers, just send them out to Jessie and she'll share it with me, and we'll send it out to our email list.
So maybe you said 26 for that, the flyer says the 24th.
24th? What is Saturday? The days are running. 24th, is it 24th? Okay, yes, the 24th, I'm sorry.
5:30 to 6:30.
5:30 to 6:30 at the Swanee Community Center.
Oh,
Jackie, oh, that's the number. I may write it down somewhere. Oh, in your packets, you should have that flyer. Okay, that's her name, Jackie. Any other updates in the room?
It looks like we still need volunteers at the Isaiah 117 house,
Okay.
and that information's on their Facebook.
Facebook page. Okay, so volunteers needed for Isaiah 117, and that house looks really nice, you guys. I drove by it about 2 weeks ago, and it looks really good. We were working in Marion, and on our way back, Angie and I saw, I was telling her, look, there's Isaiah house, and it looks really good, really good. So they're still needing volunteers if you want to, help out. Their information is on their Facebook page. Are there any other online announcements? Okay. Anything else, Jesse, you want to add?
Salvation Army also needs volunteers if anybody's interested.
Okay, Salvation Army also needs volunteers. What did they sign up? They just call,
Just call me.
Miss Kathy Peck.
She's the director of that as well.
Oh, good. Busy, busy. All right, well, if there's no other updates, our next meeting is April the 18th. And we will do lunch again and do our session. All right, thank you, everybody, for coming. Thank you online. Bye.
The event that was at the Monterey Station, is that the business expo on April 7th?
Yes.